I have the flag queued, sir.
Okay, thank you. I don't see Shane on here yet. Dave?
I don't either. Well, we may just call out Tim, and if he misses that window, hopefully he'll pick up the back end.
Okay. Okay, it is 9 o'clock, Thursday, January 7th. And I call the meeting of the Humboldt County Board of Health to order. We'll do a roll call first. Dr. Stringham.
I'm here.
Good morning. Sheriff Allen.
Good morning, I'm here.
Good morning. Commissioner Cherry.
Here.
Good morning. Commissioner French.
I'm here.
Good morning. And Commissioner Haas.
I'm here.
Good morning to all of you. Commissioner Hill.
I'm here.
Okay, thank you. Everyone is here. Let's go to the Pledge of Allegiance. If you'll all please join me for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll go to public comment, and general public comment is designated for discussion only. The public has an opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. I'll check here. I know that Shane Moss with Nevada Gold wanted to speak in public comment. Are you on yet, Sean or Shane? Do we have any other public comment? Hearing no public comment, we'll change our order up just a moment. I think we'll go with Marsha Foreman, our community health nurse first. Marsha, are you on?
I am. So I kind of wanted to go over, I may be doing some of the things that Sean and Dr. Stringham are doing, but I just wanted to go over some of the things so I can keep the public notified of what we're doing. And I'm giving vaccines today, so that's why. So that just in case I'm outside. So how,
Marcia, Dave Mendiola here. Do you have something, you have two things going on at the same time? We're getting a lot of feedback, so there must be another computer that's on.
okay, let me tell the girls to turn theirs off. Guys, I can't do it with your guys' computer. We'll see if there's feedback. Okay, is there still feedback?
You're good.
Okay. So this is how we have been doing the vaccines, just so that everybody out there in the public and you guys know what is happening. So we have been doing it out in the parking lot. Thank you very much, Dr. Stringham and Gentle Dental, because we have been hogging the parking lot. But if I can do it out in the parking lot in their cars, and then for that 15-minute wait time, they can lay on the horn and I can help them if need be, because I need to watch them for 15 minutes. I can do up to 10 people an hour. If I have to bring them into my lobby, I can only do 4 an hour because our lobby is much smaller. So doing it this way really increases the number I can get done. So if anyone has any better ideas, believe me, I'm up to anyone letting me know. So we're doing it through the office till we can get through tier 1, which we've made a great stride at tier 1. We have, and we've also added the schools district to tier 1 per Sean. And so we will be doing again on the 21st and 22nd. And then we should be pretty well done with tier 1. With that, we're trying to do almost 60 a day, you know, and that's with our little office at a full run with vaccines, and people have been wonderful about that. So the other thing I wanted to talk about and run past everyone, and I want everyone's feedback on all this, is we would like to start our 75 and above through a drive-through pod. Patty at the senior center has been compiling a list for us. So to do it at the senior center in their parking garage, have them go through their parking garage, and she has a little over 100 parking spots. So we could watch them in those parking spots and do about 100 an hour at that point. That's the hope that way, to do that, and it would all be in the vehicles. Part of that is we're getting a lot of calls with people who are caregivers to the elderly. They're not in that tier. You know, anyone can make a case for them being in the tier, but we have to follow the tier rules or everything just gets thrown out the window type thing. So I'm hoping to do that on the 19th. If everybody agrees that's a good idea to start moving on that with that. And then in February, we're looking at either the 25th, 26th, I don't know, or either Monday, Tuesday, if we should do it 2 days, if we should do it just 1 day for the tier 2 group. I'm not sure how we're going to, you know, validate the tier 2 group. There isn't time, you know, to, okay, do you work for this? Hopefully a badge will work because part of the tier 2 is the businesses, like Walmart, the grocery stores, those type of things. The tier 2 group is education and childcare staff, which will have a large group of those done. We've done a huge amount of the schools so far. Nevada System of Higher Education, public transportation, agriculture and food processing, essential retail workers, logistics and supply chain, utilities and communications, NDOT, local emergency road personnel, community support, which is, you know, the food banks, WIC, those type of things, airport operations, mortuary services, remaining public health workforce, law enforcement, schools, those type of things, NDOT inmates. So that's tier 2. The big thing that I need is I'm one nurse, one shooter, and I have 1.5 AAs. We can't do this alone. None of the other clinics have opted to give the vaccines because there's an unbelievable amount of red tape, paperwork, computer work. It's not just giving vaccines that goes with this. So Janet is doing it at the hospital for inpatients, for staff, that type of thing. But for all others, that's landing on one office until we open up tier 2, and then Walmart and Ridley's is going to help also. So my big thing is I need everyone's help. When we start these pods, you know, when I do the flu pod in the fall, it's easy to ask 5 to 8 shooters to come and help me for 5 hours, and for the police department and the sheriff's office to do, you know, traffic control and that type of thing once a year for 5 hours in that type of situation. It's another thing to ask people to help at least minimum twice a month. And I'm thinking that we probably need to do it 2 days in a row to get the amount through that we should. And we're going to have the first vaccination, and then we're going to have a second vaccination. So we would have to be doing that twice a month minimum. So that's 4 days. So it's a biggie to ask people for 4 days a month to volunteer their time. And there's always the risk. Everyone knows, you know, everyone's afraid of COVID. It's just a natural reaction. So anyone that can help, I need your help. So if you have anyone, please have them call the office, that type of thing. Right now we're scheduling through the office, so you can call the 623-6575. We do have some openings for the 22nd for those in the tier 1 group, to do it that way. I also have a huge question with the event center. So with the flu pod, the county commissioners help us with getting the event center and paying for that one thing once a year. I'm not sure if that's what the health board wants to do, if they want to use the event center, because we need a large parking lot, because we've got to have these people there for 15 minutes and people to watch them for those 15 minutes. If they want to, how we're going to do that, if they're going to waive it. I'm sorry, Dave, am I talking over you?
No, I'm hearing you. Go ahead.
Okay, so we either need to find a place that we can do these pods, which has some type of covering for the people doing it, because we don't know what the weather's going to be, and someplace with a large parking facility where we can put those vehicles for 15 minutes. Okay. We're doing our very first second dose today and tomorrow, so we're pretty excited about that. So we've got a large group of the law enforcement, health care personnel, and some of the educational staff going through for their 95% efficiency after the 10 to 14 days today, or today and tomorrow. So that's a big help to the community. Let's see. There is, the other thing I want people to realize is not only is it a staff of 2.5 people, but per Governor Sisolak, I also, each of us have to take 1 furlough day a day. So that takes a day a month away from each of us. And we still have, of course, the clinic. We need to keep birth control, STD, immunizations. We need to keep that stuff rolling too, and that type of thing. So, and Patty sent me, I know I'm throwing a ton of you out at once, and then I'll take all the questions and everything afterwards. Patty sent me a list of questions that she has received up there at the Senior Center. So right as of this day, on Tuesday, she had 187 clients on the list, and they've been adding about 30 a day. So hopefully by the 19th, I put in for 500 vaccines for that pod. Of course, I am at the mercy of the state as to how many vaccines I get. I did put a comment and a note on there that I was specifically asking for extra vaccines for the seniors 75 and above for a pod at the Senior Center. So hopefully we get those. And then, of course, like I said, we have so many who are asking about the fact that they are care providers, and it's professional care providers. We are doing the second dose of Pfizer today. We will no longer get Pfizer in this community. We will only get Moderna because it's too hard with Pfizer because it has such a short shelf life. It just doesn't work in the rules. So they're using that in the larger areas, and they're doing Moderna for the rest of us. And so it's 1 vaccination and then another vaccination in 4 weeks. We are scheduling those, and the schedule is really tight. I mean, every 5 to 10 minutes is what I'm scheduling. So when I give a time, it's not like people have a choice of the time. And then that exact same time is the same time you're going to come back in 4 weeks. We don't have the time to play Tetris with the scheduling. We just can't do it. So now I'm going to open it up for all the questions. I know there's tons of them since I went through so much so quickly.
Mr. Chairman, this is Commissioner French. I had a question if I could.
Mr.
Ken, I
Chair,
think you're muted.
Okay, sorry about that. Before you do, Commissioner French, I think Wendy wanted to say something.
Okay.
Thank you, Chairman. Wendy Maddox, Deputy DA for purposes of the record. Ms. Foreman, I just want to thank you for all that great information you've provided. I know that this board will be able and ready to help you. So I just want to let you know, as far as this meeting goes, your item is informational only. So I understand that you're concerned about tier 2, the place, the people, the days. And I'm happy for you guys to have discussion and talk about it, but we will have to put it on a future agenda of both the health board and likely the commissioners, as that may involve some money to have a place. So just wanted to let you know that. Thank you.
Okay, is there enough time before the 21st or 22nd, or are we short on that time?
The 21st or 22nd of January?
Yes.
No, I think that we can get a meeting together rather quickly. We have to have 3 days posting, and of course, I can.
I'm
Yeah.
sorry, I'm wrong.
Oh, okay. February.
February. I'm sorry, my calendar is so full because we need to keep first and second doses straight.
No, you're good. I understand that we have plenty of time, and we will get that at the next agenda. I believe next week we have a meeting, and I know we also have a commission meeting on the 19th of January.
Okay, thank you, Wendy.
Okay, we'll go questions now. Commissioner French, you had a question?
Yeah, I think before I ask this specific question of Marcia, I'd like to circle back on the comments that came from our deputy DA. If the open meeting law is going to create a bottleneck with regard to us being able to make decisions as this board, I think one of the things I would offer is that we make our agendas broad enough in scope that we can actually make these decisions here, as opposed to narrowing that subject matter so small that every time somebody tries to make a decision or tries to deal with issues that are presented to us in these meetings, that we fall back on the open meeting law as being a way we can't make a decision. I would just say that if the open meeting law is making that a problem for us, maybe our agendas are too narrow in scope. Having said that, Marcia, I was wondering if you had a call out for asking for assistance and help. Those folks that provided us the the flu vaccines and whatnot. And my understanding is that we're at 5 people that do that, assist you with regard to those vaccinations, or are there other entities out there that could step up, i.e. the EMS staff, i.e. National Guards coming from Caleb Cage. I'm thinking maybe if this is if we're seeing a bottleneck with regard to the people who are actually going to provide this healthcare, these services, that maybe we could reach out more broadly in a community standpoint. And the other side, and the other thing I wanted to ask you and get you thinking about is you mentioned that there was issues with regard to paperwork. And I'm wondering, is that paperwork federal in nature, or is it state in nature? Is there something that leadership within the counties and or the state could actually elevate with regard to creating our own bottleneck and actually making it more difficult for us to seamlessly put this vaccine into the public? And with that, I'll just yield back. Thank you.
So we do have the ability to ask for help with the paperwork, and I think Sean has the ability to reach out for that. As far as healthcare for the shooters and that type of thing, I have talked with Jordan at EMS, and so hopefully they'll be able to help us, and I'll ask for the nurses. We will need, people to watch over those folks for that 15 minutes to walk through parking lots, those type of things. We'll need traffic control, we'll need runners. So not only do we need the shooters, but we need bodies.
Okay, thank you.
And both my supervisor and the nurse practitioner, Tammy, who has been on these board meetings before, they have volunteered to drive out here, and they will help me with any pods that I need help with also. The hard part is that us state nurses, we really can't help each other because each one is in the same pickle. Each one is trying to provide for their county the best they can. So everyone's used to the very max of their ability.
Thank you. Dr. Stringham, any questions?
No, I sure don't. I just think that I'm really pleased with the job that Marcia's doing. Marcia, we really appreciate everything that's going on. We realize how many logistics difficulties you're facing, and I think I speak on behalf of all of us that we're really happy with the job you're doing. Thank you very much.
Thank you.
Commissioner Cherry.
I have no really other questions. Commissioner French kind of touched on the ones I had. Just maybe one more in regards to, you said you wouldn't be using the Pfizer product anymore. If you got if your first shot was a Pfizer from Pfizer, your second shot would have to be the same. Is that correct?
That is correct. You have to have the exact same. So that's why we're finishing our second round of Pfizer vaccines today. So they got Pfizer to start with, and so they'll get Pfizer today and tomorrow.
And then going forward, you'll use the other product, I assume.
Yes.
Okay.
All the others, the 2 weeks prior, we used Moderna.
Okay, thank you.
Uh-huh.
Okay, thank you. Commissioner Hill.
I don't have any questions. Thanks.
Thank you. Sheriff Allen.
You know, the only thing I have right now is I do think Captain Wilkin has some information that will kind of dovetail into Marcia's conversation there, either now or when he's up. I think we have a lot of information that'll fill in those gaps.
Okay, thank you. Commissioner Haas.
Yes, Commissioner Tipton. I completely agree with Commissioner French on the agenda. It needs to be considerably broader so that we can help the community quicker. And I want to thank Marcia for all her help. That's it.
Thank you.
Okay, I had one question, Marcia. You had said that you could do 10 people per hour in the parking lot, but then when you talked about the senior center, you said you were prepared to do 100 per hour. Did you mean 100 per day on that?
No, I don't. So the difference is I'm running in and out of my clinic and just using the parking lot in front of Gentle Dental, myself, and Dr. Stringham's office. In the senior center, we're going to use the senior center's barn as the drive-through and their parking lot. So it will be a drive-through. It won't be where I'm walking out to the cars and giving the vaccine.
Okay, all right, thank you. Do we have any other questions of Marcia?
Chairman Tipton, can I just respond? This is Wendy Maddox in regards to the broad meeting agenda.
Yeah.
Okay, thank you. Wendy Maddox, for purposes of a record, I just want to make you aware, and I think some of you and most of you are, open meeting law requires that the public have notice of what we're going to talk about at a meeting and what we're going to spend money on or what you are going to spend money on. In fact, NRS 241.020 subsection 3D requires that an agenda consist of a clear and complete statement of the topic scheduled to be considered during the meeting. So I just want to make you aware of that. I want to let the public know that if there is something that they want you to take action on, if they just send information to me and Dave, or just to Dave by Monday by 9 a.m., we can carefully craft an agenda item and try to make it as broad as possible as to what they want to occur or what they're hoping the action the board will take. And we will try our best to make that as broad as possible and comply with open meeting law. Thank you.
Thank you, Wendy. Do we have any other questions from anybody?
Yeah, I'd like to follow up on that. I have a question. Early on in the COVID crisis, we were, as commissioners and all governmental boards, were allowed to take a little more latitude in regards to the open meeting law. Is that still there? Is that ability still there?
Wendy Maddox, for purposes of the record, we still have the emergency declarations in regard to the suspension on the physical location, the suspension on the posting of all the different areas, the 3 days still applies. I was asking Ms. Foreman the questions because I think if she had said that this needs to happen rather quickly and we can't wait until next meeting, I think that we may be able to look at case law and, consult with the Attorney General's office and say, hey, I mean, the county's declared an emergency. We're trying to get vaccines to people. And this may be one of those instances where there's an emergency. So I think that we still have that latitude, yes, to look at stuff like that. But as it's not until February, I think we also have some time to comply with open meeting law.
Okay, thanks.
I also think that there's some latitude that can be used through our emergency managers. Is that correct, Captain Wilkin? If need be.
The latitude with the open meeting in that,
No, necessarily.
if I'm hearing you correctly on that, Commissioner?
No, it would be, there's probably latitude in the office if building space, parking lots, what absolutely needed to be made quickly.
Yes, because I think we'd be covered under the emergency declaration for that.
All right. Thank you. Do we have any other questions?
Mr. Chairman, this is Commissioner French. Before we move off this subject matter, I think it's important enough. I think it's an important enough item from a standpoint of doing the work of we're needing to do here, that if there is a question along the line of our agendas and whether or not we fall under the emergency declaration or not, I would say that we probably should inquire to the Attorney General's office to see if that is the case, and let's get that question resolved so that we can move forward, or we can narrow the scope of our agendas. At the same time, we can certainly identify for purposes of for the public recognizing what we're doing and how we're spending money. We certainly could identify those items in the context of an agenda, but we could narrow the scope, or we could broaden the scope of the agenda so that we were able to take action when necessary. But if that's a problem in terms of an interpretation, I'd like to see us step forward with the Attorney General's office and ask for a clarification on that.
So this is Wendy Maddox. There's not a dispute in between the interpretation of open meeting law. We still have to comply with open meeting law. There is also the declaration of emergency that I think Wilkin was referring to. And there are some things within the state of emergency that you as a commissioners has declared that if Sean Wilkin says this is some action that needs to take, he can do that in consultation with Mr. Mendiola. You've granted him that power. So if that's something that you want him to do, as far as the vaccine and the place people days, I know that he probably would appreciate the support of the board at a future meeting, but he likely has the power to do that.
Appreciate that, Wendy. I guess my comment centers around the discussion we had following Marcia Foreman's presentation.
Yes.
And I just want to make sure that rather than us having to wait or table something, that we have the authority to take an action when it's necessary. And if that requires us to have some clarification from the Attorney General's office, so be it. Thank
Okay,
you.
thank you. I'm going to back up here. I had been notified earlier that we had somebody wanted to speak in public comment and they weren't on right when we started. Is Shane on now?
I am. I apologize. I was tying up another meeting. Thank you. Would you like me to make that comment now?
Yes, if you would, please.
Good morning. So just a few things. I wanted to mention that the premise location is nearing completion for certification as well. So they anticipate by.
Excuse me, Shane, could you please give us your name and who you represent for the public record?
Yep. once again, I'll back up. Shane Moss with Nevada Gold Mines. I'm the manager of corporate giving, and I've been working with the public response for vaccination and emergency response with the company. And then to jump back into it, our premise location there in Winnemucca is nearing the ability to give vaccinations, which I hope takes some pressure off. I anticipate around the 18th they'll be able to begin, and also offer our support. So we've got a pretty robust emergency response team and local people. So in regard to the previous request, whether that's administrative or potentially actually given the vaccines and maybe even locations or spaces, just please reach out and we'll do what we can to help.
Thank you very much. We appreciate that. And Dave has all of your contact information, I assume?
Yep, he sure does.
I've got
Thank you,
it.
Shane.
Thanks, Shane.
Appreciate everything that you do for our community.
You bet.
Okay, we'll go to an update from the Public Health Officer, Dr. Charles Stringham. It's all yours, Doctor.
Excellent. Well, good morning, everybody. The times are interesting indeed. And I think that in general, a lot of us whose job it is to disseminate a message of public safety are really having a difficult time these days because of a lot of the competing messages, a lot of the other issues that are going on these days. And I think that I'd like to begin my comments today by saying that I'm particularly proud of the work that we are doing here in Humboldt County in order to be able to get our message out to the people of Humboldt County and to make sure that people know the things that each of us needs to know in order to do safe things, make the right decisions, and in general do a good job for the things that need to happen here over during the time of the pandemic. I think that the times that we're facing are potentially going to get a little bit more interesting over the next several weeks. And I think that we're having some mixed messages in some of the numbers. The numbers have been going up at an alarming rate. And very thankfully, they're not going up quite as quickly now. And I think on the one hand, there'd be great reason to take solace and to be comforted by this. But I'd like to explain why I don't think that's the right posture. So when we visited during our last meeting, we had 781 cases that had been diagnosed in Humboldt County. And at this point, we have 864. So we're up by between 80 and 85 cases. And that's not nearly the growth rate that we'd seen. But I think, number one, we're seeing people who are making the assumption that they have COVID at this point and not necessarily opting to be tested and to do things that they've done in the past. So I'm hearing more patients these days who have self-diagnosed with bronchitis or sinus infections, allergies, and or just made the assumption that they probably have COVID, that nothing else really needs to be done, and that they can just isolate on their own. And this is concerning because it doesn't give us the opportunity as the county to be able to quarantine some of the contacts and to take a more official approach with folks, which I think is safer. It's not just a matter that the numbers are lower, but it's also a matter that we're not able to actually take the actions that I personally think we need to be taking and that we've historically taken in the past. I think over the next 2 weeks, 2 to 3, the times are going to get a little bit more interesting. And certainly we've all become familiar with what's happened in the shadow of Thanksgiving. And I think that in the shadow of Christmas and New Year's, we're likely to see an even larger jump. Hospital is really doing the very best they can to keep up with demand. They've had a lot of issues with people who are ill on staff also. I think HGH is doing a great job. And I think that it's up to each of us in the community to make sure that we protect ourselves and just make sure that the medical system doesn't have to get taxed any more than it already is. We're very concerned about this. In terms of what we're doing at this point, I'm very happy with the public awareness campaign. The primary thing, of course, that each of us have been doing in Humboldt County is in order to curb and deal with the pandemic is that we've been disseminating information to people and hoping that people will make the right decisions to be safe about things. I'm very happy about the fact that we have not made attempts to over-regulate or to encroach on people's liberties and freedoms, and instead have taken an approach of education and appealing to people's logic and everybody's desire to be safe, both for ourselves and the community. And I think that in keeping with that tone, we've scheduled for Monday, January 18th, another installment of the Ask Me Anything program. And in this case, Shane and I had an opportunity to speak a couple of days ago, and we'll be reaching out to many other employers here in the community. And we're hoping that through dissemination of our message through employers, making sure that various employers, including county and city entities, mines, other businesses, and various other organizations, that if we can spread the word about this Ask Me Anything program, that hopefully we'll get better viewership and we can disseminate our message a little bit better. So it's very happy about radio station involvement, and I think there were a lot of really good questions that we had, and we're looking forward to continuing that program. So the next installment will be 6 p.m. on Monday, January 18th, and I'll be responding to any questions that people may have. I'd like to say that I enjoyed doing our last installment, and I hope that the attendance this time can be even better, and that we can help to disseminate a message. I firmly believe that what people are really needing right now, in all facets of our lives, are answers to questions, so that we can make the right decisions in order to engage and make the right decisions. And so I think that this is a step in the right direction. We have also had arrangements to do a similar program for the Spanish-speaking members of our community, and we'd thought about just doing a Spanish-speaking Ask Me Anything Now program, and having that in the same format, basically, that the English-speaking program is. But there were several on our committee who thought that it may be a better program if we were able to do that purely through radio, and people were able to tune in, and there are various reasons why we decided to do that, and that will also be forthcoming fairly quickly too. Last time when we visited, I talked a little bit about some of the discrepancies that exist in numbers, and we're still in the process of trying to determine what those discrepancies are. Now, the nature of these discrepancies are discrepancies between the numbers that we as the county are receiving and the numbers that are being generated both by Humboldt General Hospital. I should back up and say these are new case diagnoses when I say that the term numbers. And so there are a lot of different reasons why we suspect that there are some cases that we're not capturing. And we talked a little bit last time about the fact that there are quite a number of new entities that are testing here in our county. And these include various pharmacies as well as private employers. And I just don't think there are any other ways that we're able to kind of amalgamate all of the patchwork that's happening here. And so what Nicole Maher, the Public Information Officer, and I have decided is that we're just going to reach out individually to each of the various entities who are either known or suspected to be doing their own testing, so that we're able to come up with a more accurate number. So far, the number that we have, we suspect that that number is actually going to be larger once we actually amalgamate these numbers. So Nicole and I are going to be auditing the numbers ourselves. So far, that's been happening within Humboldt General Hospital, but it's become clear that the best way for us to do this is going to be for Nicole and I to cooperate with probably Robin Dunkhorst at Humboldt General and determine what these numbers actually look like. Part of this is the interaction with Humboldt General Hospital, and it's very difficult to get a lot of this information conveyed. There are lots of different areas where we can run into inaccuracies, and this is absolutely nothing that Humboldt General Hospital is doing. I'm very happy they're doing a great job, but I think it may be in the way that we're receiving it and other inaccuracies. The other issue that we're having at this point, and I think Nicole is going to speak a little bit more about this, is that we know McDermott has been doing some testing, and Nicole and I both have knowledge of 2 individuals here in the county who were tested, and we still have not been informed of their positive status. And we're trying to figure out whether there are other people, and we're working with officials within the leadership at McDermott in order to be able to figure out what that looks like. It seems like it would be a pretty easy thing to do, but we're running into trouble at various levels, and we're in the process of auditing this. I'm hoping that next time we visit as a board, we can have some better numbers to generate or to indicate to you. Vaccinations. First, I'd like to reiterate, I think that Marcia is doing an absolutely fantastic job. I see her working tirelessly, and I'm really proud of the work that she's doing. She's just doing a fantastic job. At Humboldt General Hospital, I can't say enough good things about the vaccination program. Well organized, a lot of different things that each of us in the public health sector are trying to work on. And one of the things, of course, in the media, we're seeing a lot about distribution, allocation, and inefficiencies and things of that sort. And what I can assure you is that here in Humboldt County, I think each of us also can be very proud of this. We've given a total of just over 400 vaccinations so far. It is a very large percentage of our total allocations so far. Nationwide, only about 30%, at my last reading about 2 days ago, 29.5% of all of those vaccinations that had been delivered to states, to various locations, only 29.5% of those vaccinations nationwide had actually been given. Here in Humboldt County, the percentage is more than twice that. And so I think we have a lot to be very thankful for. But I do think that one of the biggest single issues that we're facing as a nation and also as a community specifically is that the perception is that the vaccinations aren't available, that they're not happening quickly enough, that the allocation system is really where the fault is. And what I'd like to say is that, in my opinion, here in Humboldt County, the biggest single feature that we're seeing that needs to be addressed is a fear that a lot of people still have of the vaccination. So there's a perception that the vaccination may not have been well studied, that there may be safety issues. And again, I can assure people that there are isolated stories within the news of various bad reactions and things of this nature, but they are so infinitesimal. And compared to the almost 360,000 Americans who've passed away, I think these vaccinations are safe. And I think that we can all feel reasonably comfortable taking these vaccinations. So a lot of different stories coming out of Florida about various wealthy people who've been vaccinated out of turn, and Michigan, where vaccinations are being destroyed. But I can tell you these are definitely the exceptions to the rules. And I think that the federal government, and certainly the state of Nevada and here in Humboldt County, I think at each level, there's a lot more that's going the right way than there is that's not going the right way. Again, I think we have a lot to be very happy about with the program. I'd like to end the concrete part of my comments by explaining a little bit about some of the resistance or the potential resistances that we likely will encounter, and some of the mutations. We're hearing a lot these days about the mutation that was initially described in England, in London. Specifically, it's B117 mutation, and then there's a newer mutation that seemed to come from South Africa that's being called the B1357 mutation. And I think that the general message that I'd like to deliver to people is that time is of the essence when we vaccinate. And the reason is because there absolutely will be mutations to this virus. There have been and there will continue to be. So far, none of the mutations that we've seen have a resistance to our vaccinations. So the vaccinations should work well for each of the various iterations of this virus. I don't know how long that'll be the case. And so it's critical that we move quickly. I think that our infrastructure is good. But I do think it's important that when a person's turn to be vaccinated comes up, I think it's critical that we each get those vaccinations very, very quickly. And so that we can take full advantage of the safety that the vaccinations have to give. Again, I'd like to say that I'm very proud to be working with each of you, and I think that we have a lot to be very, very thankful for. I think things are going very well in Humboldt County, and I think that we have some challenges that we face at this point, but I think we're up to those challenges. So be happy to open my presentation to questions that you may have at this time.
Thank you, Dr. Stringham. We appreciate all that you do for us. We'll move to questions now. Sheriff Allen, you have any questions?
No, just thank you, Dr. Stringham. Appreciate the information.
Thank you.
Commissioner Haas? Question, Commissioner Haas?
I'm sorry. I've got to wait until this goes off the meeting. I haven't got anything at this time. Thank you. And thank you, Dr. Stringham.
Thank you.
Commissioner Hill?
This is Commissioner Hill. No, I don't have any questions. Thanks, Dr. Stringham. I appreciate the thorough report.
Oh, thank you very much.
Commissioner Cherry?
I haven't got any questions. I just, one comment. I know it's frustrating for you to get, it feels like that you're just not reaching everyone like we'd like it to be. The radio is certainly going to reach those in around the Winnemucca area. Those of us that live out further, McDermott, Orvada, Denial, maybe even Paradise, I can't speak to all of them. The radio really isn't a whole lot of help out here. We just don't get it in most places. So just be aware of that. You know, obviously we're going to have to use different types of media to get this message out. Social media is definitely what a lot of us out here rely on because we can't get the radio stations. So just that comment. Thank you. And thank you for the great update.
Thank you.
Commissioner French?
Thanks, Mr. Chairman. Dr. Stringham, I just had maybe a clarification question. Maybe you might be able to help me on. You mentioned that 29.5% of the vaccinations have been administered nationwide. I'm assuming that because the Pfizer vaccine was the primary vaccine that was made available initially, can we make the assumption then that a lot of or much of the Pfizer vaccine has been lost then to the system if it has expired because of that statistic?
You know, that's an excellent question. I don't think that's the case. The Pfizer vaccination actually lasts for a fairly long period of time in deep freeze at -70 degrees. And so certainly if those vaccinations had been thawed, there's a finite period of time that they're good for after that. But to the best of my knowledge, there have been very few vaccinations that have actually been lost. The statistic of 29.5%, the numerator and denominator of that was the total number of people who've received vaccinations compared to the total number of vaccinations that had actually been delivered to the sites where those would be presumably issued. And so certainly I like your question because at some point, absolutely, those vaccinations theoretically would be lost. They don't last for a tremendous period of time. But I know that, you know, all across the nation, the primary issue has been the logistics, the specifics of being able to get these things done. And one of the reasons I wanted to make that comment was because, and kind of bring people, make people aware of this, is because the willingness of citizens, end users, to be able to get these vaccinations really in the end is the most critical single issue. Initially, we talked about, you know, developing the technology, and then government was concurrently involved with setting up infrastructure and various laws and other things. And but I don't think any of us really thought that in the end, the biggest single hurdle that we would face would be utilization by the actual people who would benefit from these vaccinations. And so I think as a county, what we need to be doing is concentrating on delivering the message that these vaccinations, I mean, there absolutely is a risk, it's true, but I think that risk is manageable. And I think that we really need to get this message across to people that it's best to get the vaccination, given the totality of the circumstances. That the best thing we can do, each of us, is to be vaccinated if we qualify and if it's safe for us to do so.
And one additional follow-up question, Dr. Stringham. We've had quite a presentation this morning with regard to the rollout of vaccines and where we're at with it in Humboldt County. Could you give us a little bit of a insight as to, from a statewide perspective, what it looks like from a statewide side of it?
You know, I can tell you that Captain Wilkin will be speaking about that in a couple of minutes, and I think it's really more his area of expertise, the allocation and the specifics, kind of what that looks like. And you know, Marcia touched on. Oh,
Thanks a lot.
Okay.
All right.
Okay.
And thank you, Dr. Stringham, for all your hard work. We sure appreciate it, and you've been a real asset to our community. I appreciate it.
Thank you very much.
Do we have any other questions for Dr. Stringham at this time? Hearing none, thank you. And we'll move on to an update from Humboldt General Hospital. Who do we have on from Humboldt General today?
Mr. Chair, I'm not seeing anybody that I would recognize at this point.
This is Marcia, and they are giving their second dose of the Pfizer also, so they may be very busy.
Okay. All right, thank you. We'll move on then to Alicia Heiser, the City of Winnemucca City Manager, and will provide us information regarding ongoing wastewater testing efforts. Alicia?
Hello, good morning. I will share my screen with our most recent results. So we have received our wastewater results from December 29th. Those were the last samples that were taken, and our cumulative COVID RNA concentration was at 254.89 RNA copies per milliliter. And that continues on the same trend that we've been seeing since late November, which is sort of this slow and steady kind of decrease, which I think is a positive for us. And I will also show this graph. On this one, the orange line is our wastewater results, and the blue line is our 7-day average of cases per day. And so we had that very large spike in our wastewater right at the beginning of November. And we also saw our cases per day really increasing throughout November and December. Since then, we've had a decrease in the viral RNA concentration in our wastewater, and we've also seen a decrease in our 7-day average for confirmed cases per day. So I do think that the wastewater is tracking our cases per day. The lead time that we have is still, I guess, up for debate, or it needs to be studied further. I will also note that all of this wastewater testing was paid with our coronavirus relief funds. And so far, the state has not informed us that there will be any extension to spend those funds. So as far as we know, those funds had to be expended prior to December 30th. And so the December 29th samples are the last wastewater samples that we have taken. Unless we get notice from the state that we have an extension to spend those funds, we do have a little bit, a small amount of the funds left over. We continue the testing, but if those funds are not extended, it's not a program that we will continue. So these are the results that we have so far, and possibly the last wastewater results that we'll have moving forward. And I do not have any other updates other than I will say that the Malarkey Harmony Bridge, Mizpah area, and the Warmouth subdivision, Railroad subdivision, and Skyland subdivisions were kind of all equal contributors in last week's viral RNA concentration. I'll take any questions.
Any questions for Alicia? Commissioner French?
I have no questions. Awesome information, Alicia. Thanks so much for the hard work you're putting into it.
Dr. Stringham?
No, I sure don't. Thank you very much. It actually looks like the data is pretty encouraging. And interestingly, it has proven to be pretty accurate, even at times that we couldn't really explain the trends. And so hopefully what we're seeing really will represent what we'll be seeing over the next couple of weeks. It certainly has in the past.
Sheriff Allen?
No, I don't. Thank you, Alicia. I want to extend our thanks as well.
Commissioner Cherry?
I have none. Thank you, Alicia.
Commissioner Haas?
I have none. Thank you, Alicia.
And Commissioner Hill?
Yeah, hi, this is Commissioner Hill. Hi, Alicia. I guess the only question that comes to my mind is the cost of these tests versus, any advantage that we see from this data. Does that make sense?
Yeah, so these tests, they cost $315 per sample. And we do 5 samples per week, or we have been doing 5 samples per week. So it's about $1,500 a week. I would say that the data itself is valuable. And for a number cruncher like me, I certainly like looking at the wastewater trends and then comparing it with our case trends in the future. I think in a university type environment or a research environment, it's extremely valuable. In our case, it's a little bit difficult to know what to do with the numbers. So I get the wastewater sample results, a week or 2 prior to when our case numbers start rising or falling. But quantitatively, we don't really know how much the case numbers are going to rise or fall, or how a spike in the wastewater correlates with actual cases per day, other than on a trend basis. So it's really hard to make a decision based on the wastewater data, which I would say makes it less valuable on a community level. But as far as research and data goes, I think it's extremely valuable, but I'm not sure that our community or the county health board can actually make decisions based on the wastewater results. I hope that makes sense.
Yeah, that makes sense. So I guess just to be clear, really no use for mitigation purposes, other than data and letting us know what's going on in the community. No advantage to helping us mitigate, or get ahead of something.
Well, it did help in a couple of cases. So when we saw those really large spikes in early November, we were able to send out flyers to those communities right away within a couple of days of receiving the test results. And I do think that helped put kind of curb the spread in those areas. So our November 3rd samples just showed a huge spike in the West National area. And Nicole was able to put a very good informational flyer together, and we sent that out to that community right away. And I do feel like that stopped the spread. Although we did see a spike in cases, it could have been much worse than it was.
Actually, can I jump in and say something also, Dr. Stringham, for the record? Commissioner Hill, one of the other things that I think is super critical is when we decided to reinstitute Rampart, the hospital's auxiliary hospital at the hospital campus. It was in part made based on some of the data that Alicia had been able to collect, and so it kind of let us know that that it was time to start ramping up our efforts. And so I can see where at a time like this, where the data is more reassuring, that the utility of the data may not be quite as obvious. But what I can tell you is if the data started to show a dramatic increase, it would give us probably 2 or so weeks of lead time to be able to re-ramp up on other resources. So I see it as being a really good data set and something that really does get used in making concrete decisions.
Okay, yeah, that helps a lot. I guess what I was getting at is it something that we just let go because we don't have COVID money, or do we look for an avenue to find funds to continue this? Is it worth that? Something to think about is all.
I am getting, so I have a call later on with Jennifer Cooper from the state, and she's been our contact person for the coronavirus relief funds. So the Nevada League of Cities seems to think that our extension to spend the CARES Act funds has been extended. But like I said, we haven't received that information from the state. So I'm hoping that my conversation with Jennifer Cooper later today will either confirm that yes, it has been extended, or no, it hasn't. But at this time, you know, we'd rather be safe than sorry. So we're just assuming that the funds have ended. Within our sewer fund, we do not have the ability to carry on this testing. We could probably continue for a few weeks, but you know, for continuing on for months or years, our sewer fund does not have the ability to cover the cost.
Okay, yeah,
Thank you.
understood. Thank you. That's all I have.
Did you have more, Jesse?
No, that's all I have. Thank you, Chair.
All right, thank you. Commissioner French?
Thank you. I just had one quick follow-up question for Dr. Stringham, if I could. And it kind of came up in the context of Dr. Stringham's comments with this last presentation. Dr. Stringham, what percentage of new cases that are being reported back to us right now have been collected from or reported by symptomatic patients versus non-symptomatic patients? And the reason I asked that question is that I'm wondering whether or not we are having a lot of self-diagnostics and people who are self-isolating at home until they get sick enough they feel they need to come in for some testing and or some treatment. Am I wrong there?
No, that's actually a very good theory. And I suspect strongly that that's one of the things that is happening. Many of the patients that I've talked to who've kind of self-identified based on symptoms, they have absolutely have had symptoms. And I think that that really the issue is how many people are asymptomatic, and you know, what's the percentage of people. And I think that it's still safe to assume that most of the people who get COVID do have symptoms. Most people do. And certainly most of the people who are diagnosing do have symptoms also. I think it's also the case that most of the people who are self-identifying and not getting tested probably also have symptoms. The biggest single thing that we're seeing is that people are expecting that the symptoms are going to be really vigorous and very obvious, and in a lot of cases they're not. And so many times when people have COVID, the symptoms they describe, that they simultaneously are reassuring me, no, this isn't COVID, I don't feel that sick. And so I think that A, safe to assume that most people who get COVID are going to have symptoms. B, safe to assume that the overwhelming majority of people who are getting diagnosed do have symptoms. There absolutely are asymptomatic people, but I don't think that the asymptomatic people are really driving the trend that we're seeing at this point.
Great, thank you.
Thank you. Commissioner Cherry?
I have none, thank you.
All right, thank you. Thank you, Alicia. I appreciate your reporting on this. Hopefully those CARES Act dollars will get extended and we'll be able to continue with these reports from you.
Yeah, thank you.
Okay, we'll go now to Humboldt County School District report. Do we have someone from the school district this morning?
Good morning, this is Dawn Hagnes. Sorry, I was trying to turn my camera on and can't seem to get that to work, so I'll just talk.
Okay, thank you, Dawn.
You bet. Just an update for us over the Christmas break. We did track as much as possible, and of course, it's only as good as it's self-reported. But over the break, we did have 4 reports of positive staff members with COVID-19 and 3 students testing positive over the Christmas break. We took that through from our last day of school through the first day of school, because already on the first day we had people not coming back and who had tested. As of Monday afternoon, our new numbers, which obviously helped with the 2 weeks off because our recovery rate went way up. As of Monday, we have 2 positive staff members. 2 of those that tested positive over the break had already recovered. So 2 positive staff members and 58 recovered employees. As far as students, as of Monday, we had 1 positive student still and 60 recovered students. Since that time, as we knew Christmas break would hit us, since Monday's reports, we've now had 3 additional staff. I just had 1 more come in while I was on this call. 3 additional staff who have tested positive. And we have 16 total staff that started the new year out on quarantine. We have 12 students out on quarantine right now and 1 positive additional student as of yesterday. I wanted to thank Marcia and everybody who's involved in the vaccinations for sure. We have 144 staff members who are signed up to take the vaccine so far, of about 450 employees total. Of our 144 signed up, 72 of them have already had their first dose. Our first group of 10 who were able to get the Pfizer, myself included, have our follow-up vaccine tomorrow. I wanted to touch briefly on what Dr. Stringham and then I heard some others mention regarding competing messages. And this is still a struggle for us as well. That we have a concern with a place in town, and I know I mentioned this on one of our earlier calls, that they're still not testing people that come in and are symptomatic. So whether they're adults or students, they're saying just assume you are positive and quarantine for 14 days. So we have parents calling us and saying that they are to be assumed positive because they have symptoms, but they're not going to be tested, and so the whole family will stay away for 14. Our message is clearly, if you're not going to be tested, you will stay home, your children will stay home. Let's say if it's a parent who's symptomatic but not being tested, your child will stay home for 24 days because that still is 10 days from date of assumption of positive plus the 14 days for quarantine. So it is hard for us knowing that there are places just saying, assume you're positive, you're symptomatic and not testing. I'm not sure the reason, but that definitely can have an impact in our schools if we have kids or staff coming back before they should. And not only in our schools, but obviously the community. Another concern, we did just have someone test positive again and just random information. And so they were told they needed to quarantine for 12 days. We have always gone with 10 days from date of test. And so it's inconsistent information. We are staying the course with our screening and protocols and our timelines, but I know it's very frustrating to people in the community who, depending on where they go and who they hear it from, that their quarantine dates or timelines are different. That's all I have for now. I'm looking forward to the next Ask Me All You Can about the vaccination or about COVID with Dr. Stringham. I did ask if there's a chance that possibly we could do that with our employees and have an event potentially on Friday, since we don't have kids, on a Friday in which we could do that, one in English and one in Spanish, and ensure that our employees have the best and most accurate information. And that's all I have for today.
Thank you, Dawn. I appreciate your report. Do we have questions for Dawn? Commissioner French?
I have none at this time. Thank you.
Thank you. Dr. Stringham?
No, I sure don't either. Thank you very much, Don.
Commissioner Cherry?
Yeah, Don, the numbers that of staff and students that you report, those also include the outlying schools as well?
It does. That includes everybody across all of our schools.
Okay, thank you.
You bet.
Sheriff Fallon,
I have none. Thank you, Don.
Commissioner Hill,
I have no questions. Thanks, Don.
and Commissioner Haas.
I have no questions. Thank you, Don.
Do we have anybody from the public that has a question for Don? Hearing none, thank you, Don. I appreciate it.
You bet. Thank you.
We'll go on to an update from Captain Wilkin, our emergency manager. Captain?
Morning, give me 1 second to open my share tray. Okay, can you hear me okay?
We can. I can't hear you now.
Can you hear me, Commissioner?
Yes, I can now.
So I'm going to go through a PowerPoint presentation this morning, and this was as of the vaccine planning meeting that I had on January 31st, or excuse me, correction, December 31st. And that also included state health representatives as well as representatives from the Board of Pharmacy. Tier 2, also referred to as CDC Phase 1B, covers Tier 2 critical infrastructure workforce by this priority order. So education and childcare staff, Nevada System of Higher Education, essential public transportation, agriculture and food processing, essential retail workers, logistics and supply chain, utilities and communication infrastructure, NDOT and local emergency road workers, community support such as food banks, WIC, things like that, airport, depository credit institution workforce, which is our bank workers, mortuary services, remaining public health, additional critical infrastructure, and it also has come to include patients over the age of 75 years. In Humboldt County, we have approximately 1,656 Tier 2 essential workers by our county. We have approximately 1,058 patients over the age of 75 years old. And 2 pharmacies, Walmart and Ridley's, have been opted in by the Nevada Pharmacy Board to participate in helping to administer vaccines for Tier 2. And that covers both essential workers as well as folks that are over 75 plus. This is a statewide breakdown. And this goes back to our community breakdown. The good thing with these pharmacies and what we discussed as far as our Tier 2 patients, pharmacies such as Walmart are going to be offering a vaccine for their employees. They're one of our largest retail employers in Tier 2. So those employees are going to be able to go to Walmart to receive the vaccine. And then patients over the age of 75 years also may utilize the pharmacies to receive the vaccine. And all of the pharmacies in Nevada are going to be sending notices to their patients that are 75 years or older that they can receive the vaccine at those participating Tier 2 pharmacies. So that's going to take a lot of the workload off of Marsha's office. Per my email with her on January 4th, it sounds like we are going to definitely opt in to receive the help from the pharmacies so that we have greater communication as far as them being able to reach out to their active patients. That's going to reach a lot of folks. And it's also going to open up and take some of that burden off of trying to do specific pods. So this is a huge benefit to our county. 1,058 of those are going to be available to go through the pharmacies to receive the vaccine. So the steps that we're going to have is we need approval from the counties regarding a plan for participating pharmacies to vaccinate the 3 essential worker groups, which is essential retail, logistics, community support, and patients over the age of 75 years. The employers and the point of contact for the employers and the number of employees that require vaccinations for each essential worker groups. And that covers the retail, logistics, and community support for each county. And those are some of the numbers that we went over earlier. And then the mechanism that's going to be used to notify the employees of the dates and times for vaccinations for their group. So as we move into tier 2, this latter part, as far as the notification, what we need to do, that's going to be discussed on this coming Thursday's meeting that I have with the state. That will also include representatives from pharmacy again. That'll include Marcia if she's available to be on that meeting with us as well. And we'll be able to put this information together and be able to get it into the state and how these pharmacies want to handle setting their appointments and things. It's very critical that we include the pharmacy management in on this planning to make sure that we're not overwhelming them as well, and that they're able to order a sufficient amount of vaccine based on the appointments that they're going to receive. So that's the end of this current slideshow that I have. For emergency management, we're moving forward. And some of the issues that were discussed this morning, as far as the resources, biggest thing that we need to do is establish the dates that we're going to have the pods, so that I'm able to either coordinate with other community resources such as HGH, HCHEMS, or other local healthcare providers. And we can coordinate the required people that need to be there for those pods. We can do that, doesn't have to be done in a meeting for me to do those. If we do make resource requests to the state, one of the things I have to show the state is that we don't have those resources available locally. So we do need to attempt to source resources locally, whether, it's in a form of healthcare workers, folks to watch a parking lot and things like that, before we make a request to the state of Nevada. All Guard personnel are currently assigned to healthcare missions. So if we do try to bring Guard personnel up here, which would be extremely difficult at this point, we would be pulling them from a mission that they're already assigned to, and they're only on orders through the end of March. And that was the extension they were given. Originally, those orders were in January 1st. The pharmacies are a huge benefit to us as far as this tier 2, especially with the 75 plus folks that need to receive the vaccine, because it opens up availability for them to be able to make appointments and take some of that workload off of Marcia's office. So, and at this time, for me, I'd be happy to answer them.
Wendy, I see you have your hand raised again.
Thank you. Wendy Maddox, Captain Wilken, I wanted to ask you 2 questions. I know that you are doing, as you said, a lot of coordination with the pharmacies, other health providers, the hospital. Is there some kind of a meeting that occurs so that either and I don't know if it's possible, I'm thinking of topics for future agendas, so that somebody on the health board and or the county commission can have a seat at the table and kind of understand those logistics with coordination of efforts in the community, and maybe what funding, if any, is going to be requested of the commissioners?
Okay. Wendy, can you hear me?
I can.
Okay, I'm having audio issues this morning. So the meetings right now, we're having them on Thursdays at 1:30. If anybody from the health board wants to participate in that meeting with us, they're more than welcome to. Right now, there shouldn't be any funding that is needed from us. As far as the vaccine, it comes down through the resource requests and the allocations to the communities. So right now, they haven't asked for any kind of a fiscal commitment from us or anything that is going to have any out-of-pocket direct expense.
Okay, thank you. The second question I had for you is the Division of Child and Family Services. As you know firsthand, they're often called out, to work on the scene and to deal with children that are being abused and neglected and need to be removed. Do you happen to know what tier they're in? I mean, it seems they may fall somewhere in tier 2, or is that something that's being coordinated with the governor, since they are a state agency under him?
They fall under tier 2 under the essential government workers, and I
Okay.
agree with your opinion about their exposure. State employees, regardless, they are state of Nevada employees, their vaccinations go by the county that they reside in. So whether it's DCFS, state health, Nevada Department of Public Safety, those are all handled by the individual counties where that employee resides.
Okay, thank you for answering those questions.
Okay, Commissioner French.
Thanks, Mr. Chairman. Sean, are you, first off, I appreciate your presentation. It answered a lot of questions for me. I'm wondering if the gold mines, not just Nevada Gold, but the gold mines in general are going to be contributing to the vaccination effort for their employees and to their contributing subcontractors? Or are they going to be depending on the system that we're putting in place?
Today's presentation from Nevada Gold Mines is the first discussion that I've had with anybody from the mining industry. So his presentation that he brought to us here at the health board this morning is the first that I've heard of them being involved in the vaccination process. Certainly, if they have the resources and the capability to provide vaccine to their employees in the tier that they fall in and are able to obtain the vaccine or can receive that through our programs, it gets vaccine out there faster and takes a lot of that workload off of small offices, which will reduce the resource requests that we need to make and get vaccine to employees faster. So I'm all for that.
Yeah, that sounds like a logical approach to it. I'm wondering if it's something that, from our standpoint, from a county standpoint, or in particular, whether we should reach out to those entities to determine what their intent is, so that we can get an accurate reading in terms of what the load is going to be on the distribution system in place that we're administering right now.
And part of that, Commissioner, my understanding is those workers fall, I believe, in tier 3, unless I'm missing a portion of it in tier 2. And when we move into tiers 3 and 4, it does open it up to private healthcare providers and takes a lot of that burden off of the existing public health providers that are currently administering tiers 1 and 2. So we're going to see a lot to be able to go to their private provider, regardless if they work for a gold mine or anything in tier 3 and 4, that are able to go receive the vaccine that way. So it is going to take a lot of that burden and a lot of the record keeping off of us as a health board and as a county.
Great, thanks. Appreciate
it. Sheriff Allen, you have any questions of the captain?
Can you guys hear me okay?
Yeah.
Okay. It's not to Captain Wilken, but it just raised a question in me, more to Dr. Stringham or to Marcia. And, have the vaccinations or vaccines been pushed out to the local doctors, and what's the plan on pushing it out to the local doctors? I know they receive flu shots and everything. So has that been considered, and do we know how that process is going to work?
So this is Marcia, and I've been in close contact with Janet at the hospital, and none of the physicians at the clinics have chosen to do the vaccines. Like I said, there's a huge amount of red tape, of documentation, paperwork. You have to specifically ask on a certain time for vaccines. You have to hope that they're going to send you that many vaccines. We don't have control over all of that. So they have chosen to opt out of that as far as the hospital is concerned. I'm not sure what Dr. Stringham's doing. I'm not sure what Dr. Grant's doing. I'm not sure what Golden Valley's doing.
Yeah, this is Dr. Stringham. I can kind of mirror exactly what Marcia said. Really, the total number of non-HGH related offices is very, very small. It's just those 3 entities: Dr. Grant, the Golden Valley Clinic, and then our office here. And I think that between Marcia and the hospital, things are running very smoothly. I think they're both very efficient organizations, and my interest in getting involved I just think that my time is better spent doing other things, especially because it would just be replication of various things that the community is already doing very well anyway.
Okay, thank you.
Okay, thank you. Commissioner Haas?
Commissioner Tipton, I have no questions at this time.
Thank you. Commissioner Hill?
Commissioner Hill, I don't have any questions.
Commissioner Cherry?
Yeah, I'm curious. The Fort McDermott Reservation, they've acted independently through this whole COVID issue and continue to. Do you know if there's any plans up there at where they will be doing any vaccination of their own?
Commissioner, this is Sean Wilkin. My understanding through, and Dr. Stringham or Marcia, if they want to jump in, if I misspeak on any of this, is they're designated as basically administering as an IHS type facility. So the reservation is responsible for the administration of the vaccine based on how the tiers and that information is provided to the tribal nations. And they do operate independently from us as a county because they are a sovereign nation. There should be plans for vaccinations that is separate from what I or we do for emergency management for Humboldt County.
So I will assume, I guess, then that those vaccinations would only be offered to Native Americans?
I'm going to make the same assumption as you. My answer to that would be yes. We make our counts based on the local population of the county and the workforce and the numbers that we have. And I would just assume that they use the same or similar type of breakdowns. This is a pretty universal system that I've used through this for the reservation. So I don't believe that they'd be providing it to non-tribal members.
Okay. I wonder if that's something we could check on and that could help us all as well.
Yes. So this is Marcia again. So I know in Pershing County, because I'm the county nurse over there, that we are providing vaccines for the BIA, but not the tribe. And then here, I have done multiple of the McDermott volunteer fire departments, EMS type thing, but none of the tribal members.
Okay. Thank you. Maybe it's something that we need to keep our, try to stay aware of, and if they do start administering to their own people up there, whether we could get at least the local population in McDermott proper to also be able to receive vaccinations if they would be open to it.
Commissioner, this is Sean Wilkin. I can contact the state. I know that the state deals directly with the tribe and find out if that would be permissible under the allocation of vaccines, or if we would have to determine a population count for those areas to shift the vaccine up there, and then potentially work with the IHS office to administer vaccine in that area for the tier 2 folks as we move into the next tier. So that's something I can work on over the next week.
Well, I think it would be beneficial because there are people in that age group, the older age group, that would probably, it would be an advantage to them to get there rather than to have to travel to Winnemucca, and also to risk exposure by going to Winnemucca. So, I think it'd be great if we could check on that.
Yes, sir. And the other side too, and I forgot to mention this during the PowerPoint slideshow, is the strike teams that were previously mentioned in the state playbook. Those are going to be made up from the pharmacies, and it does sound like those there is a group that's willing to come out here that's from the pharmacy groups to be one of those strike teams that would go out in the community to vaccinate people that are not able to come into either a pharmacy or a pod. So we will work on that as we go forward as well. So that's going to help us out in the same regards that you're bringing up also.
Oh, good. Okay, thank you. That's all my question.
Okay, if I haven't missed anybody on the board, I think I've got everybody. Is there any other questions at this time for Captain Wilken?
Mr.
Okay,
Chairman,
yes,
Mr. Chairman, this is Commissioner French.
go ahead.
I'm not sure if this is the time to bring this up, but the last meeting we had, we talked a little bit about the requests on the part of creating a list, so to speak, for people who are volunteering for the vaccine, as opposed to vaccine which would exceed its shelf life and have to be discarded. And I know coming from that, we received a modification of the protocols from the state, which allowed for us to create a list of people 75 and older. I get that part. But part of that same discussion, some of the people who actually requested and asked for answers to their questions were people who were in high risk categories themselves, people who had comorbidities, and especially those folks who were on immunosuppressants and cancer patients and that type of thing, who are of high risk as well. And for the same reasons that we modified the system to 75 or older, I'm wondering, has there been any movement with regard to creating another column in that same list for those people who have comorbidities who might present a high risk to overwhelming our healthcare system?
This is Marcia. So along with that text list that we're playing with, I do not want to waste any doses of this precious vaccine whatsoever. So with the Pfizer, you get 5 doses out of a vial. With the Moderna, you get 10. So we are very carefully scheduling exactly the right amount. We have had wonderful reactions with the public. So we do have those that are going to be on the next time that we have the vaccines and that type of thing. So if we have one too many, we have called and asked, and people have volunteered to wait until the next time. If we have 3 open spots, we have called and asked, and they have come from the next time the vaccines come, they've come right then. So the people in the community are working very well. So we're having absolutely no waste, and everyone understands how we're closely putting this together, and it's working.
Great. I just wanted to make sure that we could answer those questions, as opposed to any destroying any of those vaccines that might exceed their shelf life. Thank you.
Yes, we're being real careful. We aren't losing any with that at all. And part of, we're having many people call, and some of them, everyone has a reasoning why they should jump to the top of the line. That's just human nature. But we have to follow those protocols. And we also are at the mercy of what we receive for vaccines. We had to keep putting people off before we could schedule. And some people did not understand that, but we can't schedule if we don't know whether we're going to have the vaccine or not. So, there's a lot of moving pieces to all of this that, the outside public doesn't realize.
Great. Thanks, Marcia. I appreciate you trying to clarify that. And that's the nature of my question, is that there's a lot of folks out there looking for that information, and I think this is a good forum to get that out there.
Thank you, Commissioner French. Any other questions of Captain Wilken? Okay, we'll move on. We'll move on now to an update from the Public Information Officer, Nicole Maher. Nicole?
Good morning. Can you hear me?
I can.
Okay. Thanks for all the great information this morning. So in the month of December, we confirmed 458 total cases, Just to give you some perspective, in November, we confirmed 176 cases. That put us at about 14.7 cases per day. November, 5.9 cases per day. And in October, with 49 cases, we were at 1.6 per day. So since January 1st, we've been notified of 50 new cases. Our positivity rate is significantly down, 24.6%. That's down from almost 32% the last time we met. And our case rate per 100,000 is also down from just about 2,800 December 23rd, and we're now at 1,670. We're currently averaging about 204 tests per day, which is significantly down for us. And I think that speaks to some of what Dr. Stringham was mentioning, that he personally is aware of some people who have chosen not to get tested. I think we're up against quite a few barriers. The people who call me are worried about cost. They're worried about turnaround, things like that. And accessibility. Having to take days off work and things like that, since they're very limited as far as what they can do over the weekend. So Fort McDermott is up 9 cases from December 23rd. They are reporting 10 active cases. As Dr. Stringham mentioned, we are trying to work with Fort McDermott to retrieve Humboldt County's information. We are suspecting that we have quite a few Humboldt County cases there that need to come through our system. And so we've asked for a listing of those people. So hopefully that will be forthcoming. This past Monday was the 8th week in a row that Humboldt was flagged by the COVID-19 Mitigation and Management Task Force, along with 15 of the state's other counties who remain at elevated disease risk. And during this time of pause, the pause will end on January 15th, but during this time of pause, we have not had to submit our updated jurisdictional assessment and action plan. With regard to hospitalizations, I received a bit of an update from Leanne Cushway, the CNO at Humboldt General. She said that they have 7 Humboldt County residents who are currently hospitalized locally. Just to clarify, when I report that somebody is hospitalized locally, I literally am just talking about ones at Humboldt General Hospital. But please be aware that many, many people are being flown to locations outside of our area. And so that's not a complete representation of how many patients we have hospitalized from Humboldt County. Thankfully, no ventilators are in use locally. Leanne mentioned that the hospital is at extreme capacity, 95% or more. And so just a very busy time for them. I also wanted to mention that yesterday, the screening clinic began testing using the Binax Now, which is the test that we've mentioned in the past. They are set to go on that. It takes about 15 minutes to resolve that test. And as Dr. Stringham has mentioned in the past, the accuracy of it is not as high as some of the other testing that we do. However, the convenience of being able to know if somebody's immediately positive weighs heavily in our favor. It is going to be challenging for the screening clinic to, as Robin Dunkhorst, who is overseeing that screening clinic, mentioned to me, she said running 70 or more people through a Binax in an 8-hour period is going to be very challenging. So they're working on some of those logistics. I wanted to mention that we have been allotted some money to do radio advertising. You might have heard some of those radio ads. We've also got some money, a similar allotment to use for the newspaper through the CARES Act funding. And I appreciate what Commissioner Cherry said. He's absolutely right. That's why we will never rely on just one programming medium like radio or newspaper or even social media, because everybody gets their information in different ways. And so we have multiple ways to share the same messaging across those fields. Also wanted to mention that Dave and I have been working on once again reinstating the business educator program. Alicia and the city with Pam Coates, Councilwoman Pam Coates, have already begun working on this. So when the state asked us about enforcement efforts, we just shared that we would be reinstating this plan, and really the idea is to make some good visits to businesses and to share good information and just make sure that we're all on the same page. We also are using this opportunity to share that the county has a great supply of masks and hand sanitizer on hand that can be used for both employees and customers. So if you know of a business in need, please have them contact Gina Rackley's office. State total cases were up 30,500 from 2 weeks ago. The tests from the state just shy of 200,000 new tests from 2 weeks ago. The state is up just shy of 500 deaths from 2 weeks ago. Humboldt, our current cases cumulative is 864. As Dr. Stringham mentioned, we do anticipate that number will go up following our audit of numbers. That's up 83 cases from 2 weeks ago when we met last. And we are also up one more death from 2 weeks ago. We now stand at 11. Washoe, up 3,500 cases from 2 weeks ago. Their deaths are up significantly too at 513. Clark, up 24,000 cases from 2 weeks ago. It looks like that number might go up significantly after New Year's Eve. Deaths up 318 from 2 weeks ago. Lander, up 23 cases from 2 weeks ago. 7 deaths in Lander County, that's up 1. Pershing, up 509 from 2 weeks ago. Majority of those, the high majority of those, are coming out of the prison system. And 10 deaths, again, coming out of the prison system, up 9 from 2 weeks ago. Elko, up 270 from 2 weeks ago. 36 deaths, that's up 4 from 2 weeks ago. State of Nevada's test positivity rate, so you remember that ours is 24.6%. The state is at 20.2%, and that's up from 19.7% and continues to climb a little bit. As of January 5th, in Nevada, just shy of 40,000 doses of the vaccine have been administered, and this includes 1,000 second doses. So happy to hear that that's continuing today and tomorrow for us. As Dr. Stringham mentioned about the variants that are coming out of Great Britain and also South Africa, I thought it was very interesting that our Nevada State Public Health Laboratory has now screened 400 COVID positive swab specimens for the B117, that's the Great Britain variant. So far, none of those specimens have flagged, and the lab is also expanding to do surveillance for the South African variant of the virus. And as of Tuesday, which is our most recent data available, hospital occupancy 84%, that's up from 82% 2 weeks ago. ICU down 3% to 72%, and ventilators in use up 1 to 46%. That's all I have. I'm happy to answer any questions.
Thank you, Nicole. I have one question for you. I think we've talked about it before, but I'm just having a hard time grasping it. On the Binax Now, I understand that test you get within 15 minutes, and if I'm hearing this right, if you get a positive test with the Binax Now, it is positive. It's 100%. But what is the accuracy rate of the test?
Dr. Stringham, do you want to address that? Dr. Stringham, unmute yourself.
I'm unmuted now.
Right.
So that Chairman, what you said was absolutely correct. It's if a person is positive on the Binax test, it is absolutely positive. It's 100% specificity. But the sensitivity, as you've alluded to, it's true that it is not as sensitive as it is specific. And so depending on the stage of the illness, the lowest that the Binax, the lowest sensitivity, the ability to show positive if it should be positive, is as low as 25% in some cases in early stages or at very, very low concentrations of the virus. But average, I would say, is probably in the 85 to 90% range. So most of the tests that we're dealing with are in the high 90s percentage, 96, 97, 98% sensitive. And whereas the Binax Now test on average is about 85 to 90% sensitive, and under certain circumstances can be as low as 25% sensitive when a person has very, very few viral particles. So it's not super trustable, and to the extent that a lot of the work that we do, especially with the school district and other entities, where we try to take people who have this virus out of the population very quickly to prevent spread, for that particular purpose, it is not a fantastic test. The advantage is that we have a lot of them, but the other disadvantage is that the test is not the easiest to run. And so at the hospital, there are just a couple of people who are able to run this test. And so theoretically, it can be run very quickly, but it's not from a logistics standpoint, it is hard to run quickly.
What about the Abbott rapid test?
The Abbott rapid test, or the so-called ID Now test, is far more accurate. And the downside to the Abbott rapid test, to the Binax Now, to the ID Now test, is that we just don't have nearly as many of them. They're difficult to come across, but it's a much more accurate test. And so when we try to screen people, when we really need to know whether a person, if we really need to be able to trust the negative result, that it truly is negative, then the ID Now rapid test is the one that we need to do. The primary difference is one is a molecular test and the other one is an antigen test. So molecular test is really the best way to go. That's looking for viral RNA, the genetic material, and it's very, very sensitive. That's a test like the ID Now, so-called Abbott rapid test. But the antigen tests, the molecular tests, antigen tests are harder, and that would be a test like the Binax Now test. Most of those tests are not as accurate. They're easier to do. Another example of that would be the saliva test. They're just not as, when you're looking for surface proteins, it's a much more difficult thing to do, and the tests do not tend to be as accurate.
Okay, thank you.
Mm-hmm.
Other questions for Nicole? Commissioner Haas? Commissioner Haas, do you have any questions for Nicole?
Mr. Tipton, I'm sorry, I was trying to get on through the phone. I don't have any questions for Nicole. Thank you.
All right, thank you. Commissioner Hill?
I have no questions. Thanks.
Sheriff Allen?
I have no questions. Thank you, Nicole.
Commissioner French?
I have no questions. Thank you.
Commissioner Cherry?
Thank you. Thank you, Nicole. I have no questions.
And Dr. Stringham?
No, I sure don't either. Thank you.
Okay, well, thank you, Nicole. I appreciate your report. Did a good job as always. Next item is approval of the high-risk mitigation plan, and we don't need to do that one at this time. But we have till next week until the pause is over. Is that correct?
That's correct, Mr. Chair.
Thank you. So future agenda items in the next meeting date.
So, Mr. Chair, first of all, I just want to let you know I have already worked on some language to broaden the ability to address some of these issues, specifically with the health nurse and her request today. I've sent that over to Wendy, so she and I'll work on the language to make sure that it meets all the requirements of open meeting law. So then I've added that both to the next healthcare meeting, which we can talk about the next meeting date, and then also for the county commission meeting, because that's where the monies will need to be approved by the county commissioners.
Okay. Thank you. Do we want to stay on a weekly basis on this right now, or do we want to go back to the every other week? What is your opinion, Dr. Stringham?
You know, I think we've hit an equilibrium of sorts. And I think given the tools that our board has to work with, given the limitations and of the various things that we can do, given the penetration of the message within the community and the various other factors that are driving the speed at which people are turning up positive, I think we've hit an equilibrium. And I think that if we wanted to go to once every 2 week meetings, that would be reasonable. I think we're right on the cusp of needing once a week meetings versus every 2 week meetings. I don't think going to once every 2 weeks would be dangerous or hamper our ability to control things. Although if other members of the board wanted to meet weekly, that would be reasonable too. So I'm sorry I'm not coming down on one side or the other of the fence, but if there are others who'd like to weight the average to one side of the fence or the other, I would support that.
Okay, thank you, Dr. Stringham. Let's find out what everybody thinks. Commissioner Cherry.
Yeah, I don't know that there's a big advantage to meeting once a week. Marcia Formby today enlightened me a lot in what she has to do and all she has to do and how she has to do it. If there is anything that she needs, it almost seems like that we could call a special meeting of the commission or the health board if it's urgent and she needs it done right away. That may be a better route to go, and go back to just a meeting every other week, every 2 weeks for the health board.
Okay, thank you. Commissioner French.
I think with the dates being specifically or spelled out right now in terms of vaccinations and when we're going in from one tier to another, that being public, I think the need for additional information to the public, I think, is probably not going to be, I use Dr. Stringham's words, we've hit an equilibrium along that point. For those of us who are having to field a lot of questions and whatnot, we always have Dr. Stringham, you know, he's been gracious enough to allow us to ask questions of him and such. So I don't think there's much risk of holding off for every other week.
Okay, thank you. Sheriff Allen?
Yes, I'm good with every other week, and kind of like what Commissioner French said, is if you guys have any questions in the meantime, during that duration, feel free to contact us. And if we don't have the answer, we'll definitely find it and get back to who's ever asking. Thanks.
Thank you. Commissioner Hill?
Yeah, I agree. I think we've got a pretty good board put together here, and they're doing their work. I think the commission's not going anywhere. You know, we're here and we're available to help out. All you have to do is ask. So I think every 2 weeks would be fine.
Okay, thank you. Commissioner Haas?
I agree with it, with 2 week periods. Another thing you could use, you have access now with money and to the radios and different stuff. If there's anything that the people know or need to know, especially about the vaccination, you can put it out on the local medias. Thank you.
Okay. Let's set our next meeting for January 14th at 9 o'clock.
Do you want that to be the
No,
21st?
let's go the 21st, excuse me, I got ahead of myself there. Excuse me, January 21st at 9 o'clock.
Mr. Chair,
Yes,
Dave Mendiola, County Manager. So in the meantime, with respect to Marcia's request about assistance with facilities and the cost associated, I have no problem working with her and Kim Peterson on the logistics of getting that in place. And then I will and have already added that to the agenda for the county commissioners, which will be on the 19th, a week from week from next Tuesday. So that should give us plenty of time. We can do all the work. Again, I'm making a bit of an assumption that the commission will be willing to approve any costs associated with disseminating that vaccination as we have in the past on pretty much everything. So, but anyway, we can do the logistics, get that in place. So I don't think that waiting 2 weeks for another meeting causes any concerns there.
okay, I agree, thank you. Any other information we need before we go to public comment? We'll go to public comment then. General public comment is designated for discussion only. The public has the opportunity to address the County Health Board on any matter not appearing on this agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. Do we have any public comment? Please unmute yourself, *6 if you have comment you'd like to make and identify yourself for the public record.
Chairman, this is Commissioner Hill. I thought this would be a good spot to ask a question to Dr. Stringham, or maybe a preparation for his Ask Me Anything. Dr. Stringham, can you hear me?
Yes, I sure can.
Okay. On your Ask Me Anything, I think there's been some consensus in the public about how the people are released from active COVID. Maybe you could be prepared in your Ask Me Anything to cover that in maybe a little more depth of how the state is tracking those numbers and how we're releasing them off of the active list.
Okay. I want to make sure that I understand the nature of your question. So sometimes the issue of recovery, or when we define somebody as being recovered, is addressed. And when you say how we remove people from the active list, do you mean releasing them from quarantine, or do you mean considering their case to be recovered?
Yeah, I guess it would probably be more of considering the numbers recovered. So from what I'm hearing and seeing is people are saying that our active cases are remaining high, and just when those cases drop off and what the logistics of the state and stuff to get those off of the active list. I know I asked that question in a previous board meeting, but maybe out into the public, you could be prepared to answer that question for some folks.
Okay, I sure can.
Okay, thank you.
Any other public comment?
This is Patricia Tyndall from the Pleasant Senior Center, and I don't have any comments, but I do have some questions. So the first one is Humboldt General Hospital giving vaccines, or right now is Marcia the only place that is giving vaccines? That was a little confusing.
No, I think I thought it was spelled out earlier that Humboldt General is doing the vaccination of their people within the hospital, and Marcia's doing the rest of them. Is that correct?
That is correct.
Okay. Is there a cost to the vaccine? My answer to this is no, not as far as I know, but I want to make sure I'm giving people correct information.
There's absolutely no cost, no insurance, no anything to the vaccine. The federal government is providing this.
Okay,
and the state of Nevada is providing the personnel. I do want to add on to that, Patty. So just a quick blurb. So if anyone knows anyone 75 and above that is not aware of them being prepared for the vaccine and want the vaccine, to please call the Pleasant Senior Center and get on the list with Patty. I'm going to move ahead, hoping that we have the vaccine for the 19th from 9 a.m. to 1 p.m. for a drive-through, and I will take that list and call people and ask them to come 100 per hour. And then on the 22nd, we do have some open slots for those who are still on the tier 1 list that have decided they would like the vaccine. They can call the office at 623-6575.
Thank you. I have another question, and that is, we've had calls in from people that are over the age of 75. They are concerned because they live in Grass Valley in Pershing County. Can they be on the list? And we have said yes and put them on the list, but I want to make sure that that's correct.
You know, we're kind of in a special situation because I'm the Humboldt County and the Pershing County health nurse. So
Right.
I have no problem with doing that. I wouldn't want those people to have to drive 70 miles to get the vaccine. I'd much rather they drive the 10 miles into town.
Okay. I have had some questions about the Winnemucca tribe. I know we talked about McDermott and that McDermott's Indian Health Services is taking care of the McDermott vaccinations. Is Humboldt County taking care of the Winnemucca tribe vaccinations?
I have had no direction one way or another.
If someone can answer that.
This is Captain Wilkin. Can you guys hear me?
Yes, we can, Captain.
Okay, so I need to go back on 2 issues. One was the previous question that Patricia asked about vaccinating Pershing County residents in Humboldt. If Marcia does want to go forward with that, we do have to make sure that we adjust our numbers because our population count and these spreadsheets and things that we're using, those are based on Humboldt County numbers, not Pershing County numbers. We are seen as 2 separate government entities. So if we're going to do that, we need to have some communication with Sean Burke and Marcia. I know you work with him quite a bit. I just want to make sure that we're not going to have an issue where, you know, our total is roughly a little over 2,000 to 3,000 in this tier, and we receive that allocation, but we give away 200 of them that aren't in our county, and then we have to work around that. So we need to have some conversation with the state. Today's 1:30 meeting, in my opinion, if we're going to draw in residents from other counties, because I've had some state agencies reach out and I've told them no, that person needs to be vaccinated in the county where they reside and work, not come over to our county because we're moving through tiers faster. So, and then on the local tribe with the IHS on the Winnemucca colony, we haven't had any communication. You know, their tribal council isn't located necessarily here centrally. So they haven't reached out to us to provide vaccines for the local Indian colony. So my understanding is that IHS is doing that also, but we can find that definitive answer out about that at the 1:30 meeting today as well.
Thank you. Another question is, how many vaccines have we given out? And how close are we to the 75 to 80% of the population being vaccinated that we need for herd immunity per Dr. Fauci, which I think is nowhere close yet?
I think I can probably jump in on that one. Yeah, herd immunity is, it was mentioned quite a bit in the initial phases of the pandemic. I just don't think that herd immunity is going to be realistic anytime in the near future. We were hoping for a 20 million vaccinated by the end of the year. We're nowhere close to that. There are a lot of different reasons why. We were hoping that people would accept the vaccination, and a lot of people are not. And I think in the end, herd immunity will come from about 3 different constituents. Number 1 will be vaccination. Number 2 will be people previously infected recently enough to still enjoy immunity. And number 3 will include people who are just incredibly cautious and are doing the right things just so consistently that they're at very limited risk for getting this. And between those 3 groups, once that hits herd immunity, you sometimes see a very small amount at 55 to 60%. And I know 75% has been mentioned. But I think that the true herd immunity, what it means is that the person who's going to infect you themselves does not get infected. And we start to see this very conclusively in the 85% range or so. 55 to 60% is just not going to be enough to do it. So I think that hopefully we'll see the herd immunity from those 3 constituencies probably in the next 6 months is what I'm hoping. Hopefully we can do it faster if other vaccinations come online, if the rate of production gets larger, and if the number of people who are willing to have the vaccination who act quickly and cooperate with folks, that number gets larger, and that 6-month window will get smaller.
And is there any idea as to the number of vaccines we've given out?
My understanding is that it's around 400 to 425.
Okay.
Marcia, if you know differently, you might chime in also.
Marcia, do you have a more definitive number?
I'm just going to use that number. I'm just going to say somewhere above 400, and it's just to answer questions for people who are calling. And just a little comment, we have over 200 people that are over 75 that have been calling. We have had a lot of people call and say the hospital has told them to call and get on the list because they are at increased risk. They're not 75 yet. We are not keeping a list, but we're just telling them that they're in tier 3. So that's the only hitch in this over 75 list, is there are a lot of people wanting to get on the list, even though they're not 75 yet. Oh, and I do have one other question. So we are moving towards this pharmacy. Having the pharmacy, you spoke about Walmart and maybe Ridley's giving out the vaccine. Would that be that the pharmacy would be giving the vaccine to workers in essential groups, giving the vaccine to their own workers, like Humboldt General Hospital is, or giving the vaccine to the general public who signs up with them?
So Patricia, this is Captain Wilkin.
Yeah.
Yes to all 3. Walmart will be able to vaccinate their own employees. They will be able to vaccinate certain groups of the tier 2 essential workers, as well as the 75 plus. And that same applies to Ridley's Pharmacy as well. Both of those are chain pharmacies that are currently enrolled with the pharmacy provider program. I talked to them about Olson's Corner Drug as well, because it'd be a 3rd location. They would have to go through the entire process to enroll that pharmacy. And because they're not a chain, when the state did this, they did not elect to add Olson's. And it would be kind of an arduous process to do that. So we're just going to stay with the 2 pharmacies that are currently.
That's fantastic. Would people that are 75 and above that want to get their vaccine, and would they call the pharmacy? Does the pharmacy have to deal with all of that?
That is, like I said earlier, part of the logistical planning that we're working on.
Okay.
Those are separate meetings that we have. So that's getting a little bit ahead of where we're actually at with this at this point. Those pharmacies are going to contact their 75 plus patients that currently receive medications from them to schedule appointments with that group. And then for the additional 75 plus patients that want to receive through the pharmacy, we're going to work out how we're going to handle the notification part of that as well.
Okay, and my assumption is there would be no cost for that, or would there be a cost if they get it through the pharmacy? Or do we not know yet?
We don't know yet, but I'm going to make the same assumption that you're currently making, but I can have a decisive answer in 2 weeks.
Okay, thank you very much.
All right, thank you, Patricia. Any other public comment?
Mr. Chairman, this is Commissioner French.
Go ahead, Commissioner.
I just had a clarification question I needed to get from probably from Sean. Just circling around on the last series of questions. How are we going to identify, logistically, how are we going to identify those classes of workers who fall into tier 2? I mean, everybody doesn't carry an ID card that identifies them as an ag worker or a truck driver or pick your category. Yeah, I get the fact that we'll be able to logistically vaccinate Walmart employees and that type of thing in-house, but that doesn't logistically, that does not cover those people who are either self-employed or are employed outside of those larger groups.
Correct. And so that's going to go back to the pods that Marcia was discussing earlier. So under tier 2, we are going to need to move forward with the community pod. Marcia and I should be able to work those resources that we need out between the two of us. And that way I can do the request, or we can coordinate with our local agencies, and we'll have to set up the dates and times to hold those. And it is a large undertaking. As far as the vetting process goes, Nicole Maher has offered to help me out when we're going through tier 1 with notifying employers. We will notify the employers. One of the ideas I have is that we're going to have an email that we can send to the manager for those employers, and those employees can bring a copy of the email with them, so that we do have some kind of vetting process. And, it's difficult. Your question is a universal concern amongst emergency managers and the administration of this throughout the state, because I understand what the concerns are. People aren't actually in that tier. Are we actually reaching everybody in a tier? Do we have accurate numbers? Part of that, we're going to do the best that we can to vet everybody and to make this an accurate and honest process as we're going through. And some of it is still kind of going to be in the planning process right now. So we're not totally relying on the pharmacies for tier 2. They're just a big advocate for us in it.
Okay, thanks.
Any other questions, public comment? Okay, I'm going to adjourn this meeting at 11:14. Thank you, everyone. We'll see you on the 21st.
Thanks very much.